Taxes and the governor's race. Plus, it all comes back to the State Department of Health and also Medicaid. Are we going to have that discussion again? Yes. It's Mitchell Talks, the News 9 Sessions next. And we have Mr. Brill back. Mr. Herms, you and I are watching Mr. Herms's doodles.
It's a bunny rabbit with a
little carrot
on the
top,
carrot, which I thought was pizza.
It's art.
Here. Yeah,
it's art.
Yeah.
We're not judging.
You can judge.
We're judging.
It's not very good.
We can't, but you only get 55 minutes and then you pay us, right?
Exactly.
Hey, welcome back. We missed you last week.
Yeah, I'm sorry I couldn't be here. I know. I had a thing.
Make up for it this week.
I'll do my best.
Okay, let's start with the governor's race. This is interesting. While we're still in a dead heat, apparently, in the governor's race, it's the infrastructure that we want to talk about today, because now Mr. Edmondson is still talking about what he wants to do about the infrastructure and how he's going to pay for it and for education.
Well, what I've advocated, three things simply. One is putting the gross production tax back at 7%. That's where it used to be. That's where it is in Texas. That's where it is in most states. And it needs to go back to 7% in Oklahoma. Second, we decided in 2004 to exempt capital gains from income tax. We need to reverse that decision and pay simple income tax on capital gains. That's $130 million a year. And I want the other 50 cents on the cigarette tax. It was proposed at $1.50. It actually passed at $1.50 but didn't get the 75%. So they ended up passing it at $1. I want the other 50 cents, both for the budget and for public health, to keep kids from starting to smoke.
That tax increase plan is the same tax increase plan that you have, though, for fully funding education. Is there going to be enough raised from that to fund education and fix roads and bridges?
Well, I hope so.
Well, I hope so, he says. What do you think?
That's pretty interesting. It's the exact same plan for two separate things, both education and now infrastructure. And he's coming under a bit of fire for that right now, because you can't just raise the exact same taxes and have an indefinite amount of money from it. He's also hoping that the economy continues along the same trajectory that it's facing right now, which is going good, but that's not going to last forever. And there are a few parts of this that we have questions about too. For example, with the gas tax, a lot of that money is going to be going to roads and bridges after this year. With the tobacco tax, that's going to be going to the Department of Health next year. So that money won't be able to be used for education and for infrastructure. So where's the rest of the money going to come from?
I don't know. That was my problem. I just have yikes written down at the very end of this on my notes here, because the math doesn't work.
Right.
To use those same numbers again is for the people who aren't paying attention to what he's doing already, and that's going to be a problem for him come debate time.
Right, and it seems like you would have a better plan in place. Give me some real numbers. When I'm asking you for numbers, is this enough money? Well, I hope so. Well, I hope so too, but it probably isn't.
Even if that would have been a fine thing to say, even if he had just left off the "well, I hope so" at the very end. It's not like a ringing endorsement for his own plan on how to fund the state.
Right, and you would think that if you're running for governor, you'd already have the numbers pulled. Here's exactly how much we're going to need for roads and bridges. Here's exactly how much you got to do your homework before you go into these things.
Yeah. Again, I think it's interesting that he's doubling down on talking about this tax plan that pretty much already failed, even though Democrats liked it, broadly speaking.
Right.
And so I'm wondering if he knows that he's talking about something he's probably not going to be able to get through should he become governor, and if that's going to be something they're going to be able to hit Republicans with next session.
Well, he may argue we've got basically a half a new legislature coming in. So he may be able to sway that half new legislature. On the 7% gross production tax, I suspect his plan is that if it doesn't pass through the legislature, he's going to put it to a vote of the people, and the people want it to be at 7%. But when you're talking about the $300 million that would come from the increase in the tobacco tax, you're just not going to get that. I don't see it happening.
What do you guys think in terms of how the media is going to be able to handle this discussion? This is in the weeds, right? And I can just hear the Edmondson people right now going, are you going to ask the Stitt people the same questions? You're doing your job, right? Which is to really ask about these plans. Mr. Stitt's not so forthcoming on his plans. Is this benefiting him by just not saying a lot? And number two, is the media going to do a good job of putting the brand to him to have him start breaking down what he's going to do?
Well, let's talk a bit about Stitt, because I'm going to use a term here that Grant, given his age, probably doesn't understand, but it's a broken record. We're just skipping the same track over and over again, because when you talk with Stitt, it's always, I'm the outsider, I'm going to clean the swamp, I'm a businessman. And no matter what you ask them, that's the answer to the question. So we still haven't seen really a good solid plan from Mr. Stitt as well in terms of exact dollars and cents. What do you need? Where do you need it?
I'm not sure that matters to voters, though, either. I think, in at least some sense, that they don't really care about this because the weedsy stuff that Edmondson likes and the traditionally Democrats have liked and lost for is the policy stuff.
Sure.
Their voters, they get out and do that. Their voters care about that. They don't sway any opinions. And then the people who aren't paying attention like what Stitt's saying. Everything he's saying is appealing to a lot of voters. Mm-hmm. And he knows that without having to bog himself down in his plans that he may or may not have.
Right. And I would argue Edmondson's doing the exact same thing. He's playing to who he believes his voters are, which right now are education.
Well, it's going to be interesting to see how that the media follows this. By the way, when we're talking about a weedy, not that we're getting into medical marijuana, we'll talk about that in a minute.
We'll get there.
But when we're talking about into the weeds on this, do you think our media in Oklahoma is going to be able to do a good job of deciphering? You've hit it on the head. Right now, the Stitt people are staying. It reminds me of that old Saturday Night Live routine with it was George W. Bush.
Lockbox.
Yeah.
Lockbox.
State of course, that sort of stuff, right? At some point, people have to answer, and we know this. We've seen with you, when you do some real in-depth work with Mr.
Mm-hmm.
Stitt, they weren't happy with you.
They still aren't happy with me.
Okay, so the point is, does that intimidate reporters? As you start asking these questions really tough and they won't talk to you, is that an intimidation factor?
I don't think so. I don't think it's the lack of an interview isn't intimidating. It's probably the amount of deciphering you're going to have to do about knowing the $300 million is going to go here after the first year, but not for the second year, and have to figure out how to write a story that can be daunting, especially if it's a print story, and especially if it's a television story, because we have fewer seconds to tell that story in.
But quite honestly, I think, and I'll give our competition props. 4 and 5 have been doing a much better job of covering politics. Non-Doc obviously does a great job. There's some really good news organizations out there that are asking the tough questions. So I think it's not fair to say, will the media be able to go into the weeds? I think some members of the media, yes. Other members, probably not so well. It's kind of, it depends.
Okay, so here's a note for the first person in the media that asked the question I've been talking about for 2 weeks, which is ask any of the leadership, which of these guys, Stitt or Edmondson, is more in tune with the GOP leadership and their legislature. It's dinner on me at the Miller Grill. Just ask the question. I want to see how this goes, all right? For you two guys as well. Okay, well, we're talking about in the weeds. There has been the Oklahoma State Department of Veterans Affairs is back in the news. Now, we've talked about that audit, which was a squirrely political audit, which was no help whatsoever. The board meets after that audit, that Jones audit. They stood behind Doug Elliott, who's their director. And this week, Pete Reed, who's just one of the best people on this planet, okay, unveils this pilot program, which, well, let's take a look at this.
If we are looking to ever fix the system, it cannot be done internally through the VA. It's going to have to be done through a partnership with state and private sector healthcare entities. If they're not willing to do that, then they're not serious about fixing the problem.
And in its simplest terms, what this seeks to do is to get veterans the help they need quicker and with less jumping through hoops.
Bottom line, the right care, the right cost, at the right time. Those are the 3 things. In fact, one of our rules and standards within this program, if we're given permission to test the pilot program over 3 years, is to eventually get to a 20-30 rule. That 20-30 rule means that you have an appointment within 20 days and you don't have to go further than 30 miles in order to get that care. That's our rule.
And obviously that's not for emergency care.
No, emergency care is within 24 hours.
This does a couple of different things. Let's kind of walk through this. What it is, it's a pilot program, so it's a federally funded program. There's not going to be any state dollars. It sets up a network of providers. Those providers can access current VA records. There's going to be a big focus in this on physical as well as mental health. The state can control the outsourcing. It allows the state to access resources in a more streamlined manner. This will be all federal dollars, no state money, and it'll be presented to the congressional delegation. Then ultimately, hopefully, the president, Pete Reed, says.
For you folks out here, we'll start with this guy right here, okay? Go to Wikipedia for this name, Governor George Nye, okay? Pete was the ODVA director under George Nye, which had, by the way, the greatest political tagline of all time was good guy, good governor. Like Marty Allen did that. And so, again, for those millennials, go look at it.
Yeah, Pete was 29 when he headed up the agency.
29 years old.
The youngest ever to head up that agency. So this guy knows his stuff. He knows veterans. He is a veteran. This plan that he put together was 3 years in the making. It involved talking with a lot of veterans, talking with a lot of professionals, and figuring out the best way to move forward with this. He stresses it doesn't do away with the VA. All that it does, you talk with pretty much any veteran, and they'll tell you they're not happy with the service of the VA. So what this does is it helps to streamline it a little bit. It gives the state the ability to contract out with different organizations. That'll save money, theoretically, and it'll give veterans in more rural areas, the Panhandle, for example. They don't have to drive all the way to the VA. They can go to different hospitals, different doc boxes, and get their cold medication or whatever. So in theory, it's a great idea. In practice, my concern is, will the federal government say, yeah, we think you guys can do it better. We'll give you $300 million to prove it.
Well, especially when, like, the plan is to get rid of the U.S. Veterans Affairs Department. Like, it is a lie to say that the plan does it. And every time Reed keeps saying that, I'm like, no, that's your whole goal, is that after 3 years, you go, this worked, you present it to Congress and maybe to the president, and then they go, great, let's scrap the program, give all the money we're giving to the U.S. VA, deal with the states.
Right.
Now, people can quibble whether they like that or not, but, like, to say that that's not the plan, that is the plan in the end.
Ultimately, it probably is the plan, or at least to do many of the same things that the VA does. Because let's face it, they're never going to do away with the VA. The VA has a tremendous amount of money and a tremendous amount of power, and will continue to get that. But I'm sure the VA is looking at this and saying, so wait, let me get this straight. You want to prove that you can do our jobs better, and you want us to pay you $250 million to do it? Fat chance.
Yeah, absolutely. Although our VA problem is huge.
Our
here.
VA
And
problem is huge here,
and
too.
not just here, but nationwide. And so maybe we do need another injection of some kind of, I don't know, innovation at that department level.
The ideas behind this, I sat down, I read the entire report, and the ideas behind it are good ideas. It gives more local control. Anytime you've got more local control, you've got a better outcome. The VA, the federal VA, the U.S. VA is huge. So if you're a veteran and you're trying to get some care, you're jumping through so many hoops just to get that care. If it's done on a smaller level, yeah, in theory, it can be run much better. But again, is the Fed going to kick over, again, $250 million for this pilot program?
Right.
Well, we've had cheap stunts like that audit. We really have. This is the first story, I think, with Pete, what he's trying to do in terms of actually moving forward progressively into something, making an answer to something. We've had stunts about the VA, and it's always a tagline in speeches. We're going to help our veterans, and then the parade's over with, and the camera's turned off, and then we go right back to
There is a potential pitfall that this program could run into that other states like Wisconsin have run into in other programs. And the one in Wisconsin specifically I'm thinking of, when I worked there, they created this Wisconsin Economic Development Corporation. And so it is this like quasi-governmental, quasi-private industry body that then has no accountability. And so to inject some of the kind of money this way, and with some of the plans that Pete Reed was talking about, they could run into that same problem. And that agency, if you look back at the early 2010s, up in Wisconsin, was a problem for them.
And you brought up a good point. I addressed this with Pete. Basically what he's saying is that there's going to be multiple levels of accountability with this. So there's going to be a board that meets every 30 days, and then there's going to be a legislative board, I believe he said every 3 months, that reviews what that board does. There's going to be an outside auditor auditing it twice per year, and then the auditor's office, the state auditor's office, will do it once per year. So there's multiple levels of accountability here.
And certainly more accountability than what they currently have.
Oh, considerably more, considerably more. So yeah, I mean, it seems like, at least on paper, a good idea. And I spoke with one veteran this week who says anything they do is better than what they've got right now.
It's the first known instance in Oklahoma history of a task force actually getting something done. The first time in the history of the world. I talked to people when this thing started, and I said, it's a task force that you named, which is, if you look for, it's Greek for not going to get anything done, and if we do, it's a study that goes on the shelf and collects dust. This is the first time I've ever seen one that actually works. When you hear the word task force, just remember nothing's going to happen except in this one case.
But we'll see how far it goes. I mean, the governor, I asked her specifically, are you going to be bringing this to the president? She said yes. It's already going before the delegation, the congressional delegation. So it's getting some traction to start, but with a governor who's going to be on her way out the door in a few months, how much leverage is she going to have to really push this thing?
How does Steve Russell feel about this? Have you
Haven't
checked his
talked
office
to
yet?
him.
I'm
Haven't
curious to see. I mean, he was a colonel.
Right.
He's a retired Army colonel. So I'm wondering what he feels about this and how he feels about the care of veterans, not just in Oklahoma, but across the country.
I'll make that call next week.
Yeah.
Sounds good. All right, healthcare. We're still talking about healthcare, the city of Pauls Valley. Aaron, take us through what's going on down there, because this is a microcosm of what's happening in Oklahoma.
It's a mess, plain and simple. The hospital, we did a story on it a couple of weeks back when the hospital essentially went broke. They don't have the money, or didn't have the money, to even pay their employees. When I was there, you had a full hospital. We're walking the halls. There's doctors, there's nurses, there's custodial staff. You know how many patients they had in the hospital that day?
3?
One.
Okay, a little higher.
One patient. You can't sustain a hospital with just one patient. And in talking with the new management group, what they're telling me essentially is that what the hospital had done is it had focused too much on making money and not enough on patient care. So now it's the hospital that's being shunned. If you need care, you don't go to this one, kind of a thing, and people don't. And subsequently, it's running broke. So the city council out there agreed to kick in some more cash for it, but now they've resorted, they're so low on money and they've got so much debt, they've got a GoFundMe account set up.
Major financial concerns. Pauls Valley Regional Medical Center is ramping up its fight to stay open. Hospital staff tells our Bonnie Campo they need $500,000 by the end of the week. Bonnie joins us live from the newsroom with this. Bonnie?
Amanda, one staff member even offered to dip into their own pockets to give the hospital some financial security. Facing their own emergency, they've started a GoFundMe page asking for $2 million.
It is an emergent situation right now. We are operating on a day-to-day basis.
Just a few weeks back, hospital staff met with City Council. New management, Alliance Health Partners Oklahoma, says before they took over operations, the previous administration had mishandled money. The hospital employs about 130 people. Staff had voluntarily worked without pay, but recently had been made whole.
So they have all been up to date with the paychecks. They did get paid on Monday afternoon.
But many saying if they have to, they'll go without a paycheck again. Seeing a need, a handful of others have dropped money off at their doors.
Ranging anywhere from small amounts to $5 to larger amounts up to $5,000 to $10,000.
Staff say the hospital is literally a lifeline to the community. The next nearest hospital, 30 to 40 minutes away.
There are personal reasons as to why we need to save the hospital, where they're saying I wouldn't be alive if this hospital wouldn't have saved my life.
Staff say they've asked local and national agencies alike for immediate donations. Though if they can't find the money, they say they'll refuse closure until there's no other choice.
And we're not going to give up until there's absolutely no hope, and right now we don't see that.
Hospital staff will host a benefit cookout this Sunday at noon with money going straight to the hospital. More on that on the News 9 app. Bonnie Campo, News 9.
All right, you can't run an operation on a GoFundMe account. Can I start to unpack this thing? Because we'll talk about this now and then next week. Here's an interesting fact about this. The city of Pauls Valley is also in the nursing home business, okay? So this upper payment limit, we'll be talking about this next week. This is the next big story. Attention to the media. This is the next big story. So the city of Pauls Valley gets into this upper payment program to try to help fund their hospital, all right? And this week on Your Vote Counts, we had the disagreement between Leader Eccles and Representative Dunnington, because it all comes back with Mr. Edmondson is saying Medicaid expansion. Holy moly, this is all big aspect ties together. Eccles said the other day, well, it's nanny, he starts talking the nanny state stuff, right? The government always has the that has to come in and bail out. It's what Democrats say. Then Representative Dunnington said, no, here's what we need to be doing. Help us unpack this about what's going to happen next.
Well, can the state continue to afford to not take the Medicaid expansion is really the heart of this program, or the heart of this issue here, and especially when you look at hospitals like this in rural parts of the state. There are also certain elements of national immigration policies that work into this as well. But, you know, you look at this, you look at our census data that just came out this last week. I did a story on this week. You know, poverty is up in Oklahoma. Childhood poverty is the lowest, how do I put this? The gap between the national average and the state average for childhood poverty is the widest it's been in a decade. The uninsured rate went up last year. So those are all tied into the Medicaid expansion. And at some point, we're going to have to talk about whether not taking that money and getting cash infusion somewhere else, or taking that money and just, you know, holding your nose. It's going to something has to happen.
Yeah, but are political entities the best choice as far as running nursing homes and hospitals? Clearly not in Pauls Valley.
Yeah,
right.
No, and part of that, the CMS didn't come through with the money that was supposed to be behind that program. Somebody had to okay the city of Pauls Valley to take those certificates of need. Guess where that comes from? State Department of Health. Can we it's like a bad penny, it won't go away.
Is it that we just need a new model for rural hospitals? Is it that it's just like the idea of a hospital in a rural area just doesn't function the way it should, and so it should be a different thing? It should be house call doctors, it should be mobile ERs, it should be, is it that just like we should do away with brick and mortar hospitals in those rural areas?
I don't know if we necessarily can. I mean, when you get into more serious emergencies, I mean, your doc in a box can't handle it, and you need those facilities there. I don't know the answer to it, but it certainly isn't what we're doing. As far as Medicaid expansion, yeah,
right,
it's free money.
Right.
Why not?
Is there also a thing linking this back to the Edmonton stuff we talked about at the beginning here? Is there also a link between that and infrastructure? And that if we improve the infrastructure in the rural parts of the state, we may be able to help these hospitals out and get people the care they need because the roads are so bad?
I don't think the roads are the be-all and end-all, honestly. I don't think there are any ambulances that are saying, well, we're not going to travel this road because of the potholes. The potholes are bad and the bridges are certainly bad, but I don't think it's stopping any ambulances from getting to and from. I think a lot of it is just misspending of money.
So what we really need is we need medical marijuana, okay? So
it's a joint problem.
It's a joint problem. To be blunt about it,
to be blunt, right?
For our last topic this morning, let's get to this. There was an old Jim Stafford song back in the 70s. Do you remember it? It's called Wildwood Flower.
Way before my time.
It ends with Jim Stafford laughing. I was just laughing there laying on that sack of seeds. Okay, so if you're going to grow your own in Oklahoma, you got to get the seeds in. Will you take it away, Mr. Herms?
You can't.
It's
impossible. It is impossible to do that. So basically, we tried this story where we're trying to figure out all the problems we've been talking about for the last couple of weeks with medical marijuana. That's all well and good. You've got to get weed here first. Now, obviously, it's already here, but we did this from the standpoint that if you want to do this completely above board, how do you get your own seeds to start your own company, just grow your own batch at home? You can't.
Obviously, weed is already in Oklahoma, but for the patient or grower to get it without breaking the law, it's practically impossible. As Oklahoma's budding medical marijuana business takes off, patients and business owners are running into a big problem, getting marijuana into the state. Because it's still illegal under federal law, it's illegal to transport marijuana in any form or stage across state lines. But how is someone looking to get medical marijuana without going to a drug dealer supposed to get started? We started at the State Department of Health. A spokesperson here said getting seeds in the state is the $64,000 question and said we should check with the Oklahoma Bureau of Narcotics. We did, and officials here said they're still waiting for direction and sent us to the Attorney General's office to see if there was an official legal opinion. The AG's office says there isn't one, meaning there's no guidance from the state's top attorney. So we went to the feds, the Drug Enforcement Agency. They said marijuana is still federally illegal and we should check here at the State Department of Health. In the end, it all means if Oklahoma wants medical marijuana, a lot of people are going to have to take on a lot of risk.
Technically, there's nothing in this state that's going to hold you back from having a federal Schedule I drug.
There are groups like the Oklahoma Cannabis Trade Association working to help patients and growers find the best ways to operate while lawmakers wait until after the midterms. Until then, a business that's supposed to be legal will still have to operate in the shadows.
If I was a patient, I would put that burden on the grower, assuming that they are already acquiring the genetics. So a dispensary front, basically.
You can buy seeds online, and most online seed banks will say they're only selling their products as adult novelties. But no matter what you call it, buying and shipping marijuana across state lines is still illegal.
That's really kind of laughable in that the state says, sure, you can grow your own weed, you just can't get the seeds.
Right. So at some point, they're going to have to look away. The state is going to have to
like
look away.
a double face palm,
Exactly.
right?
Exactly.
You don't have to look. The double face palm is not just one, but two.
But it didn't dawn on anybody as they're putting this thing together that maybe if people are going to grow it, they're going to need the seeds to do it.
Well, not only that, at the OBN level, which isn't in my story here, it's on the web version of this, but all the growers have to track where the seeds come from in each strain, not just because of accounting things, but like what happens if there's a listeria outbreak with all this medical marijuana, or there's a bad strain of it, or whatever. They've got to track all the way back to the germinated seed, and then the state's going to go, we're not going to learn where that came from? That's insane.
Now you're really getting deep in the weeds.
Well, I have complete confidence the State Department of Health can handle this all. On that note, we should probably go soak our heads, okay, because it's just insane. But that leaves us something to talk about next week. Scott Mitchell, Aaron Brillbeck, Grant Herms, thanks for this. See this again at news9.com/yourvotecounts and on Mitchell Talks. Follow me on Twitter at Mitchell Talks. See you next week.